Hi, this is Dr. Sanjeev from Shalex Overseas. Today we'll discuss about surgical gowns. In next few minutes, we'll discuss why it is necessary to choose the right surgical gown for surgical procedures. After this presentation, you shall be better prepared to manage infection risk in operation room and how a surgical gown selection can play a vital role. Objectives of this video are to discuss the importance of managing infection risk in operation room, describe the purpose of AAMI and its Center for Gowns, outline the 4 AAMI levels for barrier protection, know the 3 questions you shall ask yourself before choosing a gown, and finally review how clinicians and materials management should collaborate to improve gown purchases to enhance the safety and controlling cost at the same time. We start with the basic and critical question: what are the main purposes of a surgical gown? There are 2 main purposes. First, to protect the patients from microorganisms carried by surgical team members or patients themselves. And second, to protect healthcare workers from contact with infectious microorganisms that the patients may harbor. Let's understand why it is important to focus on risk of infection. There are several reasons. The rise of new pathogens and antimicrobial resistant bacteria, often known as superbugs. Healthcare associated infections, also known as HAIs, is the biggest threat to patient safety. These unanticipated infections that develop during the course of medical or surgical treatment may result in significant patient illness and deaths, and prolong the duration of hospital stays, which generates added cost. A recent CDC Healthcare Associated Infection Prevalence Survey provides an updated national estimate of the overall problem of HAIs in US hospitals. Based on a large sample of US acute care hospitals, the survey found that on any given day, about 1 in 25 hospital patients has at least one healthcare associated infection. There were an estimated 722,000 HAIs in US acute care hospitals in 2011. Now we'll discuss about underestimating the seriousness of consequences. Pathogens transmitted through blood, fluids, and skin cells can cause dangerous infections such as HIV and hepatitis B and C. Surgical site infections are the most common infection type, costing as much as $11,000 to $35,000 per incident, and an extra burden of $3 billion to $10 billion annually. To give healthcare workers a consistent method by which to measure the surgical gown variant properties, AAMI established classification of standards. Association for Advancement of Medical Instrumentation, AAMI, is a non-profit organization founded in year 1967, having approximately 7,000 members with clinical, manufacturing, and regulatory expertise. AAMI is the primary source for medical devices standards to healthcare industry. Let's take a closer look for standards set by AAMI for surgical gowns. All manufacturers of surgical gowns must meet the criteria defined by AAMI TB70 2012 standards. These standards has been adopted by US Food and Drug Administration as testing standard manufacturers must follow. These standards outline the testing requirements for 4 different AAMI levels of barrier protection for surgical gowns. As an end user, how can you tell that the gown you use comply with any of these standards set by AAMI? First, don't rely on the language that may be used. Vague terms such as impervious and impermeable are easily misinterpreted and can mislead. Such language lacks specificity regarding test methods and performance. Instead, rely on the AAMI level mentioned on the label of surgical gown. That is the best assurance of barrier protection that the surgical gown provides. Now let's take a look at how barrier protection levels are defined. First of all, they are based on potential of exposure to blood, body fluids and other potentially infectious material. The classification of barrier protection levels are from 1 to 4 and are based on what we call the hierarchy of risks. That hierarchy is determined by the type, volume of fluids and duration of exposures. So what are the 4 AAMI levels? As previously mentioned, there are 4 levels, where first being the least protective and the fourth being the highest protection. For example, you may use a level 4 surgical gown for an open heart procedure with maximum exposure to fluid and other infectious material. On the other hand, a laparoscopic procedure may require a level 3 surgical gown due to small incision size and limited fluid exposure. During a cesarean section procedure, a level 4 surgical gown will be required for anticipated fluid exposure. However, during a post-mortem procedure, a level 3 surgical gown will be sufficient due to limited exposure. Let's take a deeper look into the details. This slide shows what level 1 is recommended use for. This is recommended for where there is a minimal risk of exposure, such as simple excision biopsy, ophthalmological procedures, and simple ENT procedures. And level 2 is recommended for low risk procedures, for example, tonsillectomies, endoscopic gastrointestinal procedures, simple orthopedic procedures, open hernia repair, and minimally invasive surgeries. AAMI levels 3 and 4. Level 3 is recommended for moderate risk procedures, for example, endoscopic urological procedures as TURP, arthroscopic orthopedic procedures, open gastrointestinal and genitourinary surgeries. And finally, level 4 is recommended for procedures with high risk, such as any surgery where surgeon's hands or arms go inside any body cavity of patient, complex orthopedic procedures as joint replacement surgeries, open cardiothoracic procedures, trauma, and cesarean procedures. How does AAMI specifies the test of barrier protection? AAMI uses a range of factors to establish barrier effectiveness of surgical gowns, which includes resistance to fluid or blood penetration of gown's material. 4 different areas of the surgical gown must pass the barrier efficacy guidelines. The illustration shows 4 different areas within the critical zone. These include 2 on the front and 2 on the sleeves, and the sleeve includes the sleeve seam and front includes the belt attachment point. How do you choose the right gown for each surgical procedure? To ensure that you have a proper level of barrier protection, you shall ask yourself these 3 questions. How much fluid do you expect to be present during the procedure? How long will this procedure last? And what is my role in the procedure? Remember, the ultimate decision on which barrier level to wear is determined by the clinician's judgment, which is usually a result of procedure knowledge and past experience. I'll share an example. A general surgeon who used to perform a laparoscopic cholecystectomy, which often converted to long open cholecystectomy, ordinarily his assistant scrubbing for a lap chole will choose level 3 barrier. But for this surgeon, she always chose level 4 barrier, a decision she made by her knowledge and past experience with the surgeon. Collaboration between healthcare workers and materials management staff plays a crucial role for choosing the right surgical gown to be used for each procedure. Healthcare workers and materials management staff shall weigh the specifications of surgical gowns by analyzing the risk of surgical site infections and fluid control. They must take care not to increase the cost by using overprotection, and comfort of the healthcare workers shall be taken care of while choosing the gown. When you weigh these options, you will be able to reach to the right decision as what AAMI levels for gowns are required for each facility. As overprotection shall be avoided, underprotection is a strict no-no. Once the right mix of surgical gown is chosen, the materials management shall streamline the product and vendor selection by adopting a rate contract system for consistency of quality and cost. Thank you for watching this video, and I really hope this will help you choose the right surgical gown next time. For any technical assistance, you can reach us by visiting our website or by dropping a mail at sales@shalexoverseas.com or by calling us at our helpline number, which is available 24/7 for 365 days. We have an online form to assist you in analyzing the right mix of surgical gowns required for each facility to maximize safety and minimize cost. I once again thank you for watching us. I'll request you to subscribe to our channel of Educational Video Series. Don't forget to press the bell icon so that you can receive notifications when new videos are posted.